My name is Todd Goldberg. I'm the Chief Business Officer of Avatar Medical. And the question that comes up often is, what are we not talking enough about in health IT or healthcare? And from our perspective, it really is the patient experience, but something really specific about the patient experience. Hospitals work really hard to get people to come to their institution for care. The doctors are publishing papers, they're speaking from podiums, the hospital's promoting the advanced technologies that they bring into the operating room and other parts of the institution. And all of that contributes to a reputation, and people, when they need care, will come. What we like to talk about, what we think is not being talked about enough in healthcare today, is right when that patient or family walks into the exam room and they meet that doctor for the first time. Let's say we're talking about surgery, right? Surgical services, a big percentage of a hospital's top line revenue. How do you capture more of those cases, of those patients? Well, it starts in the exam room. We believe that the catalyst for revenue for the hospital begins in the exam room, and that is the essence, that's the cornerstone of the patient experience. So in other words, if a bond is built, if trust is created between that doctor and that family, well, then that family is more likely to stay for their care with said surgeon at said institution. And then therefore the downstream revenue goes from there. And so what we do to tackle that challenge, how do doctors build trust in 11 to 15 minutes when we're talking about complex surgery, maybe brain surgery, maybe someone's coming in, they have a brain tumor. Doctors don't have more time in the current healthcare environment. The problem is that they have tools to show patients their imaging that are about 50 years old. They're showing them DICOM two-dimensional scans that are inverted. So right is left and left is right. And they're shown to the patient in orthogonal planes. And most patients don't even know what that means. And yet this is the moment where trust needs to be created, where patients make really big decisions about whose care they're going to be under. We simply convert those two-dimensional scans into 3D personalized models. And in doing so, we have some wonderful benefits downstream from there. So what we're announcing today at HIMSS 2026 is a collaboration between Avatar Medical, who makes the 3D software that converts two-dimensional scans instantly into 3D personalized models, Barco, which has manufactured an amazing piece of hardware, an auto stereoscopic screen, and I'll talk more about that in a second, and then Dell, who has the hardware stack, in other words, the computer that's GPU driven that really drives the whole operation. And so IONIS Vision is the name of the product, and what this does is instantly the DICOM file is converted from simple two-dimensional MRI or CT into a personalized 3D model. And then from there, the patient can engage with their own anatomy. If it's their brain, their own anatomy, and the doctor can leverage that 3D personalized model to conduct a consultation and really engage that patient and create a wonderful patient experience. Now, when we select a certain button on the screen, that's when the Barco product really comes alive. That is what's known as auto stereoscopic. And what that does is it causes that three-dimensional model that Avatar builds in the software to literally appear as if it's coming right out of the screen. So this is the process of auto stereoscopy. And what happens when you do that is you have true 3D. You actually have depth to the image. This creates an amazing experience between doctor and patient, where trust can be built. And again, that's where decisions get made, big decisions by families who are determining, is this the doctor and is this the institution where I'm going to have my surgery and all of the downstream care that comes from there. Doctors typically have about 12 minutes to make that connection, make sure the patient understands what's going on, the diagnosis, the prognosis, and most importantly, arguably, the plan to fix it. And this is where IONIS Vision really comes to light, because you can see the anatomy and the pathology in true 3D with depth.